Hey everyone, welcome to today's Explainer. We are jumping right into something completely fascinating today, the medically advanced world of polynucleotides. We're going to look at exactly how these biological molecules are totally changing regenerative medicine, especially for intimate wellness. And we'll break down the strict clinical protocols that actually make these treatments safe and effective. So, can DNA from salmon trout really turn back the clock on aging tissue? I know, it sounds literally like science fiction, right? But this is the exact core question driving a massive revolution in regenerative medicine right now. We are looking at a process where highly purified DNA extracts are helping human tissue essentially rebuild itself from the inside out. Here is our roadmap for today. We're going to cover the rejuvenation revolution, healing at the cellular level, restoring intimate wellness, the clinical injection protocol, and finally, why you shouldn't massage. All right, starting with part 1, the rejuvenation revolution. So to really get how these clinical procedures work, we've got to understand the biological powerhouse behind them. We're talking about highly purified medical-grade molecules. You'll see the label PNHPT. That stands for polynucleotides highly purified technology. Basically, through some intense purification and high-temperature sterilization, these DNA polymers, which, yes, are extracted from male salmon trout gonads, become incredibly safe biostimulators. Think of them like a biological scaffolding. They replenish local nucleotides, giving your cells the exact raw building blocks they need to naturally repair and regenerate. It's kind of like handing your body the blueprint and the bricks at the same time. Moving right along to section 2, healing at the cellular level. Now, once these molecules actually get into the body, it's not just some temporary superficial fix. We're talking structural repair. Polynucleotides kick off this amazing cascading biological response. First, they signal your body to ramp up its own collagen type 1 and type 3 synthesis. And the crazy part? They do this without causing any fibrotic scarring. They also trigger VEGF secretion. Those are the proteins responsible for building new blood vessels, which essentially restores the microvascular network in tissues that have lost healthy blood flow. Plus, they act like a cellular cleanup crew, scavenging damaging free radicals, and they support the repair of claudin-1 tight junction proteins. Those act like the mortar between your cellular bricks, restoring the natural barrier of the tissue. So yeah, it's a complete cellular overhaul. Okay, on to section 3, restoring intimate wellness. Let's look at how all this cellular science translates into a real revolutionary treatment, especially for postmenopausal women dealing with intimate health challenges. For this, polynucleotides are formulated into specialized Class 3 medical devices, like Nugan. This is a highly specific viscoelastic gel, and it's honestly a brilliant synergy. You've got 10 milligrams per milliliter of the PN-HPT doing the heavy lifting for long-term structural repair, mixed with uncross-linked hyaluronic acid, which gives immediate physical hydration to dry, atrophic tissue. And the real kicker here is the mannitol. It's added in as a sort of protective shield to stop enzymes and oxidation from breaking down that hydrating hyaluronic acid too fast. And this is exactly why this therapy is an absolute game changer. Whether it's natural menopause or medically induced, like from breast cancer treatments, tissue elasticity and moisture can be severely depleted. This breakdown shows how the treatment directly tackles vulvovaginal atrophy by restoring tissue elasticity and mucosal thickness. It addresses dyspareunia, significantly alleviating entry pain during intercourse. And for the broader genitourinary syndrome of menopause, it rehydrates and firms those superficial skin and mucosal layers. What you should take away from this is that it offers a hormone-free, highly effective way to physically rebuild tissue, radically improving a woman's daily comfort and quality of life. Which brings us to section 4. The clinical injection protocol. So how do we actually get these miraculous molecules exactly where they need to go? Well, a patient's experience is highly structured. It kicks off with a thorough consultation to check symptoms, medical history, and overall suitability. From there, the doctor maps out a very precise treatment plan, deciding the product, the route, and the number of sessions. Step 3 is the minimally invasive injection session itself, using highly localized techniques. And finally, it wraps up with strict aftercare and review. This whole structured journey ensures every biological mechanism we just talked about is triggered safely and effectively. Now, you've got to appreciate the sheer precision required here. The clinician actually has to adapt their exact injection technique based on the specific anatomical zone they're treating. For the labia majora, they'll use a linear retrograde technique to smoothly distribute the gel along the dermal tissue. But for the delicate labia minora and the vestibule, they switch to the microwheels technique. This involves injecting tiny 0.1 milliliter hives of the gel, spaced exactly half a centimeter to a centimeter apart, with the needle angled precisely between 30 and 45 degrees. It is a highly specialized, millimeter-perfect medical procedure. And 3 to 4 is the magic number here. That is the typical number of initial sessions recommended for a full treatment plan. They usually space these out about 7 to 14 days apart. Doing it this way allows the restorative results to really compound and gives the tissue optimal healing time. Let's move to our final part, Section 5, Why You Shouldn't Massage. Now, this brings us to a critical safety pivot in our explainer. Because the gel is placed using those tiny, spaced-out microwheels we just talked about, a huge question comes up. What post-injection manual massage protocol ensures uniform dispersion of polynucleotide micro-droplets across the anterior wall? Like, how do those little isolated dots of gel actually connect and smooth out to protect the entire mucosal wall? Well, the answer comes down to this absolute non-negotiable rule. The medical sources are incredibly explicit here. The distribution of this powerful biological gel is exclusively a medical procedure. It is not, I repeat, not, some DIY aftercare step for the patient to figure out at home. It's the physician's job and theirs alone. Immediately after the injections are done, while the patient is still right there in the clinic, the doctor performs a prolonged, carefully applied manual massage of the treated areas. It's this controlled, immediate clinical manipulation that mechanically guarantees the microdroplets spread uniformly across the anterior wall and diffuse perfectly into the surrounding tissues. So what does that mean for you when you head home? It means a strict hands-off policy. There is absolutely no at-home manual massage. Patients really need to understand that trying to massage the area themselves won't speed up healing. In fact, self-manipulation risks worsening local discomfort. Unprofessional handling can easily cause bleeding by disrupting the carefully placed product. And on top of that, intercourse and anything else causing friction or pressure must be avoided for several days to let those polynucleotides safely integrate into the tissue matrix. Just let the science do its thing. It truly makes you wonder, doesn't it? As regenerative medicine evolves and we learn to harness things like salmon trout DNA to repair human tissue at the microscopic level, what other secrets might our own cellular blueprints hold? The possibilities for the future are pretty staggering. Anyway, thank you so much for joining this explainer. Hopefully, you're walking away with a solid understanding of both the incredible power of polynucleotides and why those strict clinical boundaries matter so much. Keep learning, and we'll catch you in the next one.